So diving deeper into this particular article, I want to talk to you about some nutrition and diet things. So we were talking about estrogen and muscle strength and muscle power, and estrogen is directly correlated with our muscle strength and power. So as our estrogen goes down, so does our strength and power. But what can you control and make better? So modifications to our nutrition is very important. I am always talking about vitamin D, because vitamin D is an actual hormone and it is very important for our bone health. So with menopause and perimenopause, if you want to talk about nutrition, what can you do to be better? You need to up your intake of protein, okay, like 30 grams with every meal. You need to supplement vitamin D because every single person needs to supplement, and take omega-3s. Those are three basic fundamental things I think all people could agree that it's going to make a difference. It is going to make a difference in perimenopausal women. Protein intake is the next thing you really need to get serious about, because the evidence suggests that the total energy and protein intake decreases with our menopause transition. Indeed, this decrease in energy intake is observed, and we are burning 254 less calories a day. However, the mean body weight changed minimally over this time, and this can be explained by a reduction in energy expenditure. So we move less and we burn less. But a reduction in protein intake over time during the menopausal transition is also observed and could negatively impact your ability to be full and your weight gain. So if you are wanting to be more full, you will have more fiber and protein in your diet to keep you full. So as our estrogen decreases, we have less, we don't want to move, which means then we burn less calories, but we also don't deal with protein as well. So you have to be mindful of protein, but consuming protein can help your metabolism. Talking more about vitamin D promotes protein synthesis, calcium and phosphate transport into muscle, and helps muscle strength. The current data provides evidence that the beneficial effect of vitamin D supplementation on muscle strength, physical performance, and prevention of falls and fractures in older women. Why don't we say it like this? If we supplement in perimenopause, we will transition seamlessly into our next phase of life, and I really don't want any of us to break bones and fall. So could we just start agreeing that we need to supplement? But also test, don't guess. I get my blood work done every 6 months to check my vitamin D levels. And I know that if we correct a vitamin D deficiency, you could feel better, have less joint pain, and it will make you have a better ability to make muscle mass. This particular article will talk about the Mediterranean diet because it is an anti-inflammatory diet, and it is a high saturated fat ratio. So basically oily fish, olive oil, avocado. If you have been following some of the menopause experts on this platform, this is not new information. I get asked a lot about creatine supplementation. Yes, and it has been shown that a low dose of 1 gram doesn't get it done, but a dose of 5 grams a day does get it done. And it doesn't matter what time of day you take the creatine, it's just you take it every day. I personally put it in my morning smoothie. And the reason that we're doing this creatine is, one explanation is the muscle integrity has been upregulated with creatine use, resulting in an increase in satellite cell activity, growth factors, protein kinases, and myogenic transcription factors. Just know that we should take the creatine, and the risk is very minimal. So if you want muscles to be strong, you want to be functional, and you want to be phenomenal as you age, and you don't want to have sarcopenia, which is muscle loss, well, these are the things you're going to have to do. You are going to have to make healthy lifestyle changes. You're going to have to modify your diet, making sure you have adequate protein, sufficient vitamin D, omega-3s, regular physical activity, and hormone therapy if you choose. That is the key to healthy muscles past perimenopause, menopause.